I'm Ashish Jha. I'm an internist and I'm a professor of health policy at the Harvard School of Public Health. And today I'm going to be talking about health information technology. So why talk about health information technology? Well, the US healthcare system, we know, faces a whole set of challenges, especially around costs and quality of care. And good information management is key to delivering care that is safe, effective, and efficient. I have practiced as an internist both in IT-based systems and using paper-based records. And I can tell you, paper-based records are a major source of problem for many of the challenges we face. When I'm practicing as a physician, I can't access data when I need it in a paper-based world. I can't share data with others very easily. Paper-based records lead to lots of errors and make it very, very hard as a physician, as a healthcare system, to learn and get better over time. So is there actually evidence that health information technology is important? There is. There have been over 400 studies that show that health information technology, when done well, can have a substantial impact on care. The evidence is strongest for things like electronic prescribing, which we know can reduce medication errors by as much as 95%. And good clinical decision support tools can help doctors and nurses make better decisions. And that can lead to both better care and more efficient care. The evidence actually has been so overwhelming that there has been bipartisan support for broad-based use of health information technology. From the left to the right of the political spectrum, everybody agrees more health information technology, used well, should improve care in America. So let's talk a little bit about the state of health IT policy in the US and where we have been over the last decade. So the modern history of health information technology policy in the US really starts in 2004, when President Bush called for universal use of electronic health records by 2014. When the president said every American should get their health care through electronic health records, the first question we wondered was, where are we now? What is the state of health information technology adoption and use in America? And when we examined the evidence, we found out very quickly we really had no idea. The definitions of what is an electronic health record weren't well delineated. Most of the data out there were of poor quality. The surveys were not very good. They were not very representative. They often had low response rates. And so fundamentally, if the goal was to get to 100%, we needed to know where we were starting off. Because if you're at 80%, it's a very different set of policies that you need to get to 100 than if you're at 10%. So the key initial step in the efforts to try to promote HIT was to begin by understanding where the country was. And this is where high quality data becomes very important. So two big surveys were done and published in late 2008 to early 2009. And the two surveys first focused on ambulatory care, focused on doctors. And what we found was that 83% of physicians had no electronic health record at all. 13% had a very basic electronic health record, and 4% had a more sophisticated, comprehensive electronic health record. So 17% had some electronic health record, and 83% had no electronic health record. When we then looked on the hospital side, the numbers were even worse. Only 9% of hospitals had an electronic health record. 2% had a comprehensive record, 7% had a basic record, and 91% of hospitals had no EHR at all. And then we asked doctors and hospitals, what's holding you back? What's really making it difficult? And what we found, the number one answer that hospitals gave was inadequate capital. They just didn't have the money to buy these systems. They also reported that the maintenance costs were very high. About a third of hospitals said that there was substantial physician resistance. Another third of hospitals said that the return on investment from HIT was really unclear. And about the same number of hospitals said that they didn't have the staffing necessary. And so when you take a step back and ask what's holding people back, it was primarily about money, money, and money. That was the big challenge that hospitals were facing, and doctors reported very similar numbers. That led to something called the HITECH Act. HITECH Act stands for the Health Information Technology for Economic and Clinical Health Act. It was part of the stimulus bill that was passed and signed in 2009, and it allocated $27 billion for doctors and hospitals who meaningfully used health information technology. The incentives were targeted towards doctors and hospitals. They were administered through Medicare, primarily, though Medicaid has also been involved. And Congress said it's the job of the administration to define what is meaningful use. And Congress went down this road because what we knew was simply adopting EHRs wasn't going to get us where we wanted to go. We really needed to use these systems in a meaningful way. So what has the impact been of the HITECH Act? Well, when we look at electronic health record adoption among US physicians, as I said, in 2008, about 17% of doctors were using an electronic health record. That number was up to about 22% in 2009 and 25% in 2010. And so what that tells us that on its own, EHR adoption was increasing at about 3 to 5% a year. The incentives began in 2011, and we saw a big bump, a 10% bump in 1 year, meaning 1 in 10 doctors adopted an electronic health record between 2010 and 2011 alone. And that number has continued to rise, rising up to 42% by 2012, the last set of data that we have. On the hospital side, the numbers are even more dramatic. We started at 9% in 2008, rising to 12% in 2009, 15% in 2010. So in the pre-HITECH era, before the incentives kicked in, hospitals were adopting EHRs at about 3% per year. The incentives began between 2010 and 2011, and what you see is a big bump in 2011. The number of hospitals adopting EHR jumps to almost 27%, and by 2012, we're at 45%. So we've gone from 9% in 2008 to almost half the hospitals in America using an EHR in just 4 short years. So what's the early assessment? How do we interpret this? Well, what I conclude from this is that well-crafted, clearly focused incentives can work. We know EHR adoption was moving very slowly. When the incentives kicked in, there has been a big uptick. EHR adoption really has taken off. We're nearly halfway there in terms of getting all the doctors and hospitals on board. And then when you look beneath the headline number and look at what doctors and hospitals are doing in terms of adopting underlying functions, you see lots of progress. And that suggests that over the next few years, we're going to see continued uptake of these technologies. A big challenge with electronic health records is around sharing of data. One of the things I said earlier is that a key part of what frustrates me about paper-based records is my inability to share those data easily. Unfortunately, most EHRs don't talk to each other. They don't connect seamlessly and easily. And so the policymakers have put in a bunch of different efforts and approaches to try to get information exchange happening more smoothly. One is around these things called HIOs, Health Information Organizations. These are often nonprofit entities that have sprouted up that are trying to bring organizations together to share data. There's something called the DIRECT program. What DIRECT is essentially it's a secure clinical email where you can send information seamlessly to any other provider in the country who's on the DIRECT system. But the bottom line is, despite these efforts, we all think the progress on health information exchange has been very slow. Even now, only a small minority of doctors and hospitals are able to and actually sharing data. But of course, the goal of HITECH was not just to get doctors and hospitals to start using technology. It was about improving care. And what is the impact of HITECH on improving care? It's too early to tell. We don't know. But what we do know is that the recent data that have been coming out have been somewhat disappointing. We have not seen big gains in quality or big gains in efficiency from the uptick in EHR adoption. And there were some early data from RAND and others that had predicted big savings, that if we just got EHRs into hospitals and doctors' offices, we would somehow save billions and billions of dollars. They have not materialized. I would argue that where we are with the HIT and the lack of big impact so far is actually not unexpected. In other industries that have adopted information technology, it has typically taken 1 to 2 decades before you saw the payoff. And I would argue we don't have 1 to 2 decades in the US to wait for the payoff to happen. And so there's a lot we can learn from those industries and try to move the ball forward. So what does it take to get to better care? Well, the other industries teach us that it's not just about technology. It's about the features of the tools that individuals use. It's about things like organizational complements, such as the training of the people who are using it, the workflow changes that technology induces. It's also about payment systems. If our payment system continues to reward quantity over quality, don't be surprised if health information technology doesn't lead us to better care. But as we make changes in our payment system to be more value-driven, technology will become a key underpinning of our efforts to improve care and to be more efficient. Finally, technology is inherently disruptive. In other industries, entire industries went away because they couldn't handle the onslaught of new ideas and innovations that technology gave birth to. The question is, will that happen in healthcare? And what will be the costs be if that happens? It's one thing for companies to go out of business. When hospitals go out of business, when doctors' offices have to shut down, there are real human costs of that. We have to think about that and be thoughtful as we watch the disruptive technologies take hold. What we know is getting health information technology right is essential. This has been a challenge globally. No country in the world has figured this out. Countries around the world are struggling with getting information technology into place, and countries around the world are struggling with getting health information exchange into place. But all the countries in the world, and especially the US, has been very focused on this because we know IT is key infrastructure for healthcare reform. If we want a high-performing healthcare system, we're going to need to have IT that works and works well for doctors and patients and for other providers. The HITECH Act, passed in 2009, is having a big effect on adoption. It's getting doctors and hospitals to adopt and use these systems in ways they never have before. But that's not the final goal. The final goal is turning IT into better care. That's the challenge, that's the work ahead, and that's where we need to put our energies. Thank you very much.